The management team at Federal Medical Center Abuja has clarified the unfortunate case of Ms. Ifunanya Nwangene, who died from complications after a snake bite. According to the statement by the hospital management, the staff acted promptly and with the utmost care upon Ms. Nwangene's arrival. They noted that the medical staff provided immediate and appropriate treatment, including resuscitation efforts, intravenous fluids, intranasal oxygen, and the administration of polyvalent snake antivenom. The hospital said after a thorough but quick evaluation, it was clear that Ms. Nwangene suffered severe neurotoxic complications from the snake bite. They said despite all efforts to stabilize her condition and transfer her to the intensive care unit for further treatment, she experienced a sudden deterioration just before the transfer. They dismissed claims of non-availability of anti-snake venom and inadequate response, saying it doesn't reflect the reality of the situation. I'm joined now by a head snakebite treatment and research hospital at Katungo in Gombe State, Dr. Nicholas Haman. Dr. Haman, thanks for joining us on the news tonight. Very sad development. Let's begin by finding out, medically speaking, how deadly can snake bite be and what determines whether a patient survives or not?
Thank you very much for having me. I'm Dr. Nicholas Amani Haman from the Snakebite Hospital and Research Center, Katungo. Of course, the level of deadliness depends on actually so many factors. It depends on the size of the snake. And of course, if mostly the larger snakes tend to have high dose of venom. And of course, at times also we have a situation whereby the younger snakes too release a large dose of venom whenever they actually bite a patient, a victim. Also, it can be due to environmental factors. It can also be due to presence of actually a barrier between the bites, the snake and the bite site. Let's say if somebody is wearing a cloth, of course, when you bite through the cloth, the amount of venom that will enter into the system will be actually be reduced by the barrier that is in between. And of course, another issue is the fact that whenever it depends on the type of the snake too, because we have snakes that are actually, mainly snakes are either neurotoxic, in the case of cobra, and cytotoxic. It can be also hematotoxic in the case of carpet viper. It can also be cytotoxic in the case of puff adder. But actually, you don't have snakes that are having just one hematotoxic, neurotoxic only. They will combine at least two of them. The most common example is one that affected Ifunanya, which is likely to be a cobra, which actually both neurotoxic and hematotoxic. So its level of deadliness also can be influenced by this number of times spent before coming to the hospital. Because the earlier the presentation, the earlier the treatment, and of course, the earlier the recovery. Thank you.
So it matters what happens after a snake bite and when you get medical help. A very common practice, Dr. Haman, is to tie a rope or cloth around the area where you have been bitten to stop the venom from spreading. Does that actually work?
Well, these are actually an old-fashioned news because when a person is bitten by snakes, it's most important when you tie that particular area, you're restricting blood supply, both venous and arterial to that area. That means you're localizing the effect of the venom to that particular limb, leading to more damages too. Another thing is that when you tie it, of course, you're also blocking blood supply too, which is also going to affect the cellular function of that particular limb that's affected. So we actually discourage that as much as possible. We discourage application of tourniquets. We discourage application of bringing a cut at the site of the bite. Also discourage as much as possible application of stones or any other thing that is believed to be drawing the venoms out, because clearly seen.
Dr. Ahmad, in the critical minutes after a snake bite, what exactly should be done before a victim goes to the hospital?
Yes, the first thing that the victim is supposed to do is that as much as possible, the limb should be immobilized. Immobilized, by what I mean by immobilized is that as much as possible, you should limit the use of that particular limb that's affected. One, if there are rings or even bangles around that site, one should remove it. And of course, the patient should not be allowed to lose that particular limb that has been affected.
Okay.
I should be immediately wash the site with just soap and water. if you're going to take any analgesia, should be only paracetamol, because diclofenac also mimics the effect of side effect of diclofenac, mimics the effect of carpet viper. And also the patient should be rushed to the facility. Here in Kaltungo, we emphasize that it's better to come to the hospital if you feel like something like snake has bitten you, so that we have facilities here, we have personnel that can be able to identify the snake that bites, most likely the species of the snake that bites you, and of course offer appropriate treatment in good time.
We hear that most of your patients are herders and farmers. Does it worry you that it often takes a high-profile case like this one in the city for attention to come? What should change so snake bite is treated as a serious public health emergency?
Yes, actually, snake bite, according to statistics, affect 43,000 people annually in Nigeria, 1,900 deaths. But you'll be surprised to hear that you don't hear about these things, because most of those people that are bitten by snakes are herders and farmers, which are actually not having a political voice. As much as possible, it takes this kind of cases, high-profile cases, for this attention to go there. Unfortunately, we are hearing this news today because it has actually affected somebody that is having a voice this time around. So I think this is one area of concern for us that are treating snake bite, that are into research and treatment of snake bite, because it's time for the international organizations, the NGOs, to look at this particular area for intervention, because you are treating malaria because it affects those that are having voice. You're treating TB because it affects those that are having voice. But now we are forgetting snake bite because those ones are in the bushes. The highest radios they use are those transistor radios, and they don't even have area anywhere again to comment again.
All right. The big one is that this victim was reportedly sleeping, and when you check the video, it doesn't look like a village or a bushy area. So everyone is concerned. How do I know if there are snakes in my house? Are there particular things that bring them or that make your environment favorable for snakes to cohabitate with you?
Thank you very much for this question. It's actually true that snake usually harbor areas that are actually bushy, and of course areas that are in the bushes and all that. But we've actually established it in this facility through a research. We established that snake bite among pregnant women, we discovered that 97% of those women were bitten at the peridomestic spaces, that's in the household area. So that means whenever there's an interaction, human environment interaction, there is actually a possibility that there will be overlap of those appetites of snakes in such a way that they can also occupy areas where we have where people are living. Let's say, for example, those snakes require areas that are a bit dark, and of course, they places that they can hide and live. So once you have those kind of areas that they can easily hide and live, of course, we can find them in the peridomestic spaces.
So what do you do now to ensure that you don't have snakes in your house?
Yes, as much as possible, we encourage what we call fumigation. There are chemicals that are being used. There are chemicals that are actually being used to actually push them away. We use that a lot in this facility because we are also located in the area where we have a lot of snakes. So we usually encourage it, especially at the change of weather, when we are transiting from the cold weather to the hot weather, because mostly snakes during the cold weather, they go into brumation. Brumation is that they find places to hide because they are ectothermic. That means they are cold-blooded. They cannot control their temperature. Right. So cold can easily kill them. So that is why, as much as possible, especially when the weather changes from cold weather to hot weather, as much as possible, there should be insecticide application of chemicals to actually scare them away.
Fumigation mode activated then. Head snake bite treatment and research hospital in Katongo, Gombe. Dr. Nicholas Haman, thank you for talking to us.
Thank you very much. Nice meeting you all.